I'm Pendle Dewhirst, and I'm a psychologist with Horizon Health Network, and I work on a child and youth team in Fredericton. ODD is a childhood onset disorder, which means that it starts in childhood, often during preschool or during adolescence, which are tricky parenting times anyways. And it is a behavioral disorder, so all the symptoms are behavioral. These are children who are often angry or irritable. They exhibit defiance, so they have a really hard time being told what to do and then doing what they're told. These are children who will often blame other people for mistakes that they've made and have a hard time socially often. It has to cause some sort of impairment in their life. Based on those symptoms, a lot of children exhibit those symptoms sometimes. We all don't want to do what we're supposed to do sometimes, and we're all irritable and angry sometimes. So to meet criteria for ODD, you have to meet 4 out of 8 criteria consistently for at least 6 months. And for preschoolers who are prone to being angry and irritable and not doing what they're told, they have to show those behaviors at least 5 days a week for 6 months. So really big behaviors or a lot of behaviors that would impair functioning. So the nice thing about a behavioral disorder is that parents pick up on it pretty quickly. And Horizon and the government of New Brunswick provides access to Strongest Families, which is a parent skill program. It's run out of Halifax, and it's a phone-based program, meaning that somebody calls you at home and walks you through different parenting skills. And so that's a really nice first line of defense when you're seeing behaviors that seem out of the norm and you don't need a diagnosis to access that service. And then on every school team in the province, there is a child and youth member who sits on that team. And so as problem behaviors come up in the school, the child and youth team member will help that school figure out, is this part of normal development or is this something more? And maybe we can get these parents set up with some services. Doctors and psychologists can diagnose ODD. Typically, we're looking at a nice broad assessment. We want to make sure that it's ODD we're looking at and not any of the many other disorders that it looks like. So we're doing clinical interview with the parent. We're doing behavioral questionnaires with school and home and any other adult that the child spends a lot of time with. And sometimes we do behavioral observations depending on where the defined behaviors are happening and who they're happening with. Boys are more commonly diagnosed with ODD. It's about 1.4 to 1, the ratio. Symptoms often sort of start in preschool, or they will show up strongly in adolescence when we're going to see more of those sort of defined behaviors anyway. Families who are lower socioeconomic status are at a slightly greater risk because ODD and experiencing trauma or negative life effects have a very strong overlap, and being within a lower income family is considered a stressor or a negative life event, so there is some overlap there. ODD can persist into adulthood, and it can have some very difficult impacts for an adult. It's very difficult to maintain employment if you have a hard time with authority or being told what to do. And so then you can suffer some economic hardships if you continue to have ODD into adulthood. It's also difficult to maintain healthy relationships with romantic partners or with friends if we're angry and irritable all the time. It's just difficult. So that's an impact. And then there's also overlap with substance use disorder, anxiety, depression, social difficulties. So there's definitely impacts if ODD isn't treated as we go into adulthood.
My name is Beth Hatchard. I'm the clinical coordinator of one of the child and youth teams in the Fredericton region, and I work on the north side of Fredericton. One of most effective treatments is parent training, so helping parents learn different skills and strategies for how to parent their child who has ODD. So that sometimes looks like parents only, sometimes that can be parent and child, sometimes that can also be family therapy, depending on what the dynamics are. And that parent training helps teach different types of skills that really can accommodate and support children with ODD in ways that maybe more traditional parenting strategies have not worked successfully. Through Horizon, there are child and youth teams that are across the whole province of New Brunswick. Every region has child and youth teams, and every school in New Brunswick has a child and youth team attached to them. So families can self-refer, can be referred through their doctor or through their school to the child and youth team for support, and that team can work directly with the parents. Sometimes the child, it depends on the circumstance. Often it's more effective to work just with the parents, especially if the child is younger. Often as they get older, there might be beneficial to incorporate the child into the treatment, but often it is most successful when you're just focusing on working with the parents and helping them develop different types of skills to parent their child. We know that parenting kids with ODD is really hard. A lot of times parents feel judged by maybe their doctor or the teachers at their child's school, feeling like they're doing something wrong, but understanding that different types of parenting strategies can be really effective, focusing on connecting with their child, thinking about it in ways of working collaboratively to solve some of the problems that are causing outbursts at home, looking at their child's behavior as not always having the skills they need to meet the expectations of the environment, and not as they don't know what to do with their child. Having a more proactive approach can really be beneficial. Parents can access their local child and youth team. They can call themselves to refer, and they can work directly with somebody on the child and youth team to help develop different parenting skills. In the Fredericton region, Child and Youth also offers parenting groups. So specific to Fredericton, there's a group called Nurturing Change with Families. And through that group, we teach skills related to how to effectively connect with your child and how to do some collaborative problem solving with your child as well. So that is a group that is accessible in the Fredericton region when you're connected to the Child and Youth team.